I want to tell you why I am asking you for donations to a fund to support research on nutrition and mental health. I remember a day in December 2000. I was standing in a hotel exhibit hall in Vancouver at the annual meeting of the Canadian Psychiatric Association. I was standing in front of our poster that showed the effective treatment of bipolar symptoms in a group of adults who had taken a broad-spectrum micronutrient formula. By micronutrients, by the way, I mean mostly minerals and vitamins. And the data from that poster did go on to become the first peer-reviewed publication showing the effectiveness of this novel treatment, and was published in the prestigious Journal of Clinical Psychiatry. So I was standing in front of the poster, and a rather tall psychiatrist from Alberta came over, read the poster, and then he saw the list of ingredients on the side, and he ran his finger down the list, peering at them. I can still see him as he reached the bottom and asked the bombshell question: which one is the important ingredient? Well, I was amazed. Could an educated physician such as this man really not understand that the brain is dependent on all of the micronutrients for optimal neurotransmitter function? You see, sometimes it seems as if everyone has their own kind of favorite nutrient or small set of nutrients. And sometimes they're trendy, like right now. Vitamin D is quite trendy. About a year or so ago, omega-3s were very trendy. I'm predicting next year it might be magnesium. But these are all important. It is true that vitamin D is very important. Omega-3s are very important. Magnesium is very important, but so are the B vitamins, so is calcium, so are the trace minerals, vanadium, so are the other minerals like zinc and copper, etc., etc. You see, our brains have evolved to need about 50 micronutrients, 50, every day and in balance. In other words, what I should have answered that psychiatrist was, there is no one important nutrient. Little did I know in 2000 that this issue would continue to haunt us. We scientists trying to evaluate the potential benefit of broad-spectrum micronutrient formulas found that we had a huge struggle to obtain research grants to support our studies. The granting agencies and the reviewers always asked, which is the important one? And even today, years later, the funding still goes to studies of single nutrients. The grant reviewers sometimes even tell us, use this same design, but study one nutrient at a time rather than a broad spectrum formula. So now we know that that's how granting agencies work, but it's not the way the brain works. In spite of the lack of funding, I want you to know that my colleagues and I here in Canada, New Zealand, and the United States have made a lot of progress on this topic, even on shoestring budgets. So, for example, I'm pleased to tell you that there are over 25 peer-reviewed publications in medical and scientific journals showing the benefit of multiple nutrients in formulas for the treatment of people with many problems like mood and anxiety disorders, ADHD, as well as psychosis and substance abuse. I myself have seen micronutrients work in really profound ways. For instance, I saw and helped publish a case of a young boy who became completely well on micronutrients after having been plagued by hearing voices, seeing things, obsessional thinking, paranoid thoughts, delusions, and who had been treated with all the usual conventional treatments and medications to no avail. He became well on micronutrients, and we have been following him, and so far he is still well after 5 years. In another young boy, I saw complete resolution of a very intense obsession, and the obsession was with guns. So you can imagine his family was truly frightened. I could give you so many stories. There are hundreds of stories, thousands of stories like this. But of course, what we need is scientific verification, and for that, we need research funding. So here's one last important fact that really tipped the balance for me. Right now, we are losing excellent scientists who want to study this important intervention looking for benefit of multi-nutrient formulas, but they cannot fund their research careers. And so I see junior colleagues drifting away to try to find grants in other areas. They will have to study other things, even if they're passionate about nutrition, because they have to be able to have funds in order to sustain their careers. That's when I decided to enter the world of philanthropy, and that's why I'm speaking to you now. In the United States, with the help of a wonderful independent community foundation called the Foundation for Excellence in Mental Health Care, I've established a fund to support research on multi-nutrient treatment of mental disorders. This Oregon-based foundation will issue charitable receipts that make American donations tax deductible with the IRS. It happens that this particular foundation's entire focus is on improving the quality of treatment of our loved ones who struggle with mental disorders, so I'm very pleased to be working with them. I am asking you to please join with me by donating to this fund. Please click on the website that you may have gotten in one of my emails or on the website that you're seeing at the bottom of your screen right now. It's mentalhealthexcellence.org. When you go to that website, please click on Donate, and then there's a drop-down menu. If you just look for the word nutrition, you will find the Nutrition and Mental Health Research Fund. There you can help with a tax-deductible donation. Thank you very much.